Good morning and welcome to our community affairs program that we call 30 Minutes. Today our special guest is Mr. Skipper Bondurant, the administrator and CEO of Baptist Memorial Hospital, Union City. Skipper, it's always a pleasure to have you in the studio and get an update what's going on with Baptist.
Yeah, I've always enjoyed sitting down with you, Charles, and sharing what's going on in the hospital and the community and healthcare. And I also appreciate what you do for this community and what Thunderbolt does. So, source of truth, still in the news. So appreciate that.
Well, I do appreciate that very much.
Yeah,
I really do. And it's great to have met you when you first started, and I think we've developed a good friendship over the years.
I agree.
And now you've been at the hospital for how many years?
Well, it'll be 12 years this summer.
Wow.
I've been back home. So, of course, I was born and raised in Obion County. And so, yeah, Ginger and I and the kids have been back here this June. It'll be 12 years. Yeah. So
it's
12 years can go by fast, too.
But, yeah, when you said 12, I would have never thought that. I was guessing 6, 7 or something like that. So it's been a good fit for you then.
Oh, absolutely, yes. I love being in my hometown community, in my hometown county, serving the needs of the healthcare community. So it's just, it's a dream come true, just a good fit. So.
Well, everyone's glad you're here and proud of all the things you do at the hospital and out in the community, believe me.
Thank you.
Well, since you've last been on the program, Skipper, I'm sure there's been many things going on at the hospital. You're always changing and growing, and we want to get an update on what's going on here at Baptist in Union City. And you and I were talking before the program, and I just always have to give comments about the new women's clinic. That is such a feature for Union City and Reelfoot Avenue.
Yeah, we're blessed to have that. They've been in that now over a year. So moved into that last February, I guess. So 12,000 square feet that the Women's Health Center of Union City occupies on the bottom floor. Upstairs, the plans this year, in fact, we're bidding it out right now. We're going to try to start building out half of the space upstairs and planning on moving the Stern Cardiovascular Foundation from across the street in the Medical Arts building over to this new building. So they'll occupy about half of it upstairs. So that's, I guess I haven't really announced that publicly, so you're kind of hearing that news for the first time. So.
Well, good deal. It doesn't seem like it was that long ago since we did the ribbon cutting that day, and they were turning dirt, and that's another project that just came on fast, and now I'm seeing patients and doing very well. Yes.
Doing very well, and people probably don't realize how busy our OBGYN department is at the hospital. We're on pace this year to deliver almost 750 babies in our hospital.
The whole complex there, from the doctor's clinic, the hospital itself, the cancer center, the women's clinic, the whole complex is just really nice for the community.
Yeah, thank you. We're proud of it.
Well, let's just see what's going on. And first of all, I see that Baptist Memorial Hospital has been honored for patient safety and price transparency.
So recently, less than 20% of the nation's hospitals were recognized for excellent patient safety ratings and the highest level of adherence to federal price transparency rules. On April 9th, the Health Transformation Alliance, the Leapfrog Group, and a company called Turquoise honored 472 hospitals across 42 states. Each of the organizations received a Leapfrog ACE safety rating, which is kind of like school grades, so it's A to F. Union City was one of those A ratings. Our sister hospital, Carroll County, was also one of the only hospitals in West Tennessee to receive this honor. So only a total of 19 hospitals across the state of Tennessee has received this recognition. So, our staff does just a wonderful, great job with quality and safety, and it's because of their dedication that we receive these type of recognitions. So we're very proud of it.
It's quite an honor, too, isn't it?
Absolutely, absolutely. So these are outside organizations that are giving us this. We don't apply for these things. These are outside organizations that are saying, hey, Union City's doing a pretty good job with safety and quality. So,
well, how do the outside organizations know your workings and what you're doing to to determine this?
Yeah, it's public reported data, a lot of it. Sometimes it's questionnaires that they have to send us, and we fill out those questionnaires. Leapfrog uses a very large questionnaire, and it's twice a year that we actually submit this data to them. So,
does this involve feedback from patients also?
Not necessarily in the Leapfrog safety scores, but their patient outcomes that are included in that. So those are the type of quality outcomes that are recognized in things like this.
Well, anytime you're recognized on a positive note for what you're doing, it's good for your organization, and it's good for the public to hear.
Absolutely. And again, Union City has always excelled in the things that we do in that hospital. We do really well. And again, it just really ties back to the type of staff that we have at that hospital. So it's all because of their dedication.
This recognition like this, is this something that your staff kind of shoots for or aims for, or is it just something that's awarded because that's just the way they work?
Yeah, it's more so that they're coming to work to meet a need. They're dedicated to produce great quality and safety every day. It's a calling instead of a job for all of us. So. Yeah.
Wow, congratulations on that.
Thank you.
And you recently had National Doctors Day. What is that, Skipper?
Sure. Doctors Day is always celebrated in March. It's usually the last day of March. And on Doctors Day and every day, we offer our heartfelt gratitude for our physicians and all that they do. We appreciate their partnership to serve the healthcare needs of our community. Specialties represented at Union City. Not a lot of people realize how many specialties that we have represented in our community. OBGYNs, pediatrics, orthopedic surgery, cardiology, internal medicine, nephrology, general surgery, vascular surgery, gastroenterology, family practice, radiation oncology, oncology and hematology, pulmonary and sleep medicine, interventional pain, radiologist, podiatry, emergency medicine, hospitalist, pathology. So being in a smaller community, we have a lot of services to offer this community. So, and also too, speaking of cardiology, and with Stern Cardiovascular Foundation, we are welcoming a new doctor, Dr. Goyle, to the medical community. He's a cardiologist. He's going to be joining our staff, and joining Dr. Goyle will be Matthew Keithley, who's a cardiovascular operating room nurse. Matthew's a Union City native. He, in the fall of this year also too, and this is brand new knowledge. Both of these physicians, Dr. Matthew Davis, will be joining our staff as a urologist. Dr. Matthew Davis is a native Union Cityan, so it's great to have urology back full time in our community. Dr. Goyle will start seeing patients on April 29th, so this month. And then we're shooting for Dr. Davis to be in the community around August time frame. So
they'll work out of the hospital?
They will, yeah. They'll do surgeries and procedures in the hospital, and of course they'll see outpatients in their clinics, in their clinic spaces. So again, new news to share with the community about 2 new physicians that are joining our practice.
So does your staff change quite a bit? You're adding all the time. Does that mean you're growing in a way?
It does. It does. We're constantly looking at services that we can provide to the community. We're constantly looking at things like, for instance, like urology. We haven't had that since Dr. Marcetti retired years ago.
Yeah.
So it's always been something that we would like to have. Dr. Davis being born and raised in Union City, we kind of went after him when he was when he was completing his residency. He went to Jackson for a little while, joined a larger group there, and now has decided that he wants to come back home and raise his family in Obion County. So we're excited about him being here with us here soon. So
that's fantastic. Yeah. And National Doctors Day, that's all across the nation.
All across the nation. That's correct.
Something that you recognize every year.
That's correct.
Not to put you on spot, but approximately how many staff members do you have there in the hospital?
Yeah, so when you look at our overall providers and staff members, I mean, we're talking about over 400 plus, employees in this community that are Baptist employees. So, that's looking at the outpatient clinics in the hospital, and some of those are part-time and PRN staff members, but over 400.
That's fantastic.
Mm-hmm.
That's
right. Yeah.
I've heard there is going to be something different at the hospital here pretty soon, that you're going to have a concert. Tell us about that.
That's right. So our pastoral care department, led by Chaplain Michael Dennison, and I think he's been in here before and
sure has
shared some things, has planned a spring concert for our team members and the community. It will be held on Wednesday, April 24th in the hospital courtyard from 11:45 until about 12:15. Our music guest is Voices of Proclamation from Union University. As a special treat, we'll have lunch meals in our cafeteria, whether dine-in or to-go. Will be about 20% off for the community. Should be an awesome experience through which we can, have a role in advancing the gospel in our community. In lieu of rain, we'll have it in the cafeteria. With Baptist, being a faith-based organization, this really lines up with our mission, which is, the threefold ministry of Christ. It's healing, preaching, and teaching. So we're excited about this. So it's going to be fun.
I bet you are. I've been to many different type events over and invited to the hospital there. And they benefit those who work there and those who visit and attend too, don't they, Skip?
That's correct. This is kind of a post-Easter celebration for us. So we did this last year in a little bit different avenue, and we're excited about Union joining us this year. So
public invited to this?
Absolutely. Yes.
And it'll be held outdoors, barring bad weather.
That's correct. In our cafeteria courtyard.
Yeah. Well, great. I'll get that out there for you.
Great.
Also, coming up next month is National Hospital Week. I'm sure this is pretty big too, isn't it?
It is. May 12th through the 18th is National Hospital Week. And this week will be filled with lots of fun and appreciation for, our 400 plus team members. Our colleagues are truly the heart of Baptist. And at Baptist Memorial Hospital, Union City, our caregivers not only have a career, but I believe have a ministry and a calling to produce health care. I think it's a spiritual gift. They've taken on unimaginable challenges and risen always to the occasion repeatedly. National Nurses Week is actually the week before. It's May 6th through the 12th. And we have incredible nurses who embody the spirit of compassion and care. So I encourage the community to pat a healthcare worker on the back the month of May when they see a healthcare worker out. Just thank them for what they do. So
absolutely. Will you be having some types of celebrations or events during this time?
We do. It's pretty much something every day going on at the hospital, and usually it's generated around eating good, and celebrating that way, right?
You can always celebrate with food.
That's right. So
then go down and visit your nutrition program.
That's right.
That is something. I tell you, the healthcare people, healthcare field, from you all the way down to whoever it may be, coming out of the COVID thing, you just have to have such great appreciation for these people, because that was definitely a very trying time.
It was, and we're only seeing now 12 to 15 inpatients across 24 hospitals that are COVID positive. So we've seen that really go down, and that is down from our height at Union City. We had 20 to 22 at one time in the hospital, and there were times where we were, running out of ventilators, and we were having to repurpose ventilators within our system. Getting some from Carroll County or Tipton, but the severity of COVID has really decreased. And again, the staff rose to the occasion and performed admirably. So
things that you learned during that time, they still carry on today?
They do. Yeah, we've changed some things. Some of the same protocols are in place from an infection control standpoint when we have identified that potentially this is a COVID patient. We will continue some of those, and it's really made infection control practices that much better.
Wow. So with COVID now and the variants, it's nowhere near as dangerous as it was during that pandemic time, is it?
That's correct. We're not seeing that severity as great as it was, and there's still some very sick individuals when they get COVID, but we're seeing that severity way down. So.
Well, that is great. Again, today we are speaking with Mr. Skipper Bondurant. He is the administrator and CEO of Baptist Memorial Hospital, Union City. It's always a pleasure to have Skipper here in the radio station. The hospital is seeking chest pain center accreditation. What does this mean to you?
Yeah, this is, we first received chest pain accreditation from the American College of Cardiology in 21 for a 3-year term. So we're going through that process of renewal. We take part in a multifaceted clinical process that includes a rigorous on-site review. Facilities that achieve accreditation meet or exceed an array of stringent criteria and have organized a team of doctors, nurses, clinicians, and other administrative staff that earnestly support the efforts leading to better patient education and improved outcomes. And it's truly us trying to save lives when patients come in with heart attacks and it's a process of protocols for us to make sure we're producing the greatest quality of care and safety for those patients when they're experiencing those emergencies.
So how does accreditation change from what you're doing now?
Well, we have a team of individuals that are focused on turnaround times for, like receiving an EKG out in the field from our paramedics, and that's electronically sent into the ER so they can see exactly what's going on with that patient's heart, so they can prepare in the ER for what they're about to receive. Some of those type things that we've done a better job of because of this accreditation. So it's I've heard my chief nursing officer and some of the clinical leads that are taking part in this talk about saving muscle. The heart being a muscle is the most important factor here. Saving lives and saving muscle, because time is of the essence when you're dealing with heart attacks. Getting patients out of our facility to have intervention done, whether it be Jackson or Paducah or Memphis or Nashville, so they can have stents placed and things of that nature. So
you do network with other area hospitals?
Absolutely, yes. There is a large network group. A lot of these hospitals are chest pain accredited as well. Sister hospitals in our organization are chest pain accredited. But yeah, organizing transfers and organizing protocols with them as well to help.
You made mention of something there that made me think of a question. How has technology helped the healthcare industry?
Yeah, technology is big. I mean, we use it every day. But one thing I always say about technology is that it's extremely important in today's healthcare environment, but there's always going to need a person behind that technology touching another person. So even the technology and having the best is needed for healthcare organizations. We still got to have people that are thinking of healthcare as a calling and a profession to use that technology.
Yeah. So without the help of that doctor and nurse and whoever's on staff there, technology is null and void, isn't it?
Doesn't matter.
That's crazy. That's a great comment there.
And even sometimes, with us having some of the same equipment as somebody down the road, let's just put that in perspective. A technologist can produce different quality and images and because of how they're trained or it's people skills are just as important as technological skills.
Absolutely. So. And to just think about not too many years ago, everything you did in the hospital was with a pen and paper.
It's correct. So we're now, of course, fully electronic medical records. Everything if you've been in the hospital lately, you'll see nurses and clinicians and providers wheeling around our mobile computerized carts, and they're doing everything on those carts. They're seeing orders from physician offices. They're seeing labs from across the street. Say I saw a BMG doctor's clinic doctor 2 days ago, and they drew labs on me. They can see those labs today in the hospital. So
almost instant information.
Instant, yes. Mm-hmm.
That's unbelievable to think about years ago that there was no way that was possible.
That's correct.
So wow, that is huge. Baptist also has a successful employee well-being program that's offered to the community. Tell us about that.
Sure. Today, many employers are challenged with identifying ways to enhance employee health and well-being without increasing health benefit costs. At Baptist Memorial Healthcare, our Best Health Employee Well-Being program has achieved significant success in both health outcomes for our health plan members and cost savings for Baptist. Baptist is confident that this program can do the same for other employers, so the Best Health by Baptist Employee Well-Being program to help employers control the costs of self-funded health plans by focusing on improving health outcomes. If an employer would like to discuss the Best Health by Baptist program in more detail and how it can reduce health plan costs and help employees get healthier, you can reach out to our contact at Baptist, which is our System Director of Wellbeing. Her name is Leah Lansky, at 901-227-4616, or by email, and that is Leah, Lia.Lansky, LANSKY @bmhcc.org.
That's great.
So that's a little bit about that wellness program. So.
Yes, that's great. And Baptist always, as you said a minute ago with the concert, you want the public and the community to be involved with the hospital. And I know in the past I've seen where Kara has sent over where you're having health screenings and programs and workshops and things like that. Baptist still continue those?
We do, yes. We'll partner with the Obion County Prevention Coalition on a drug take-back program. Mm-hmm. We've recently been going out to employers and doing health fairs. Mm-hmm. So things like that have been going on here recently. One thing I want to point out to the community, and I always try to do when I'm in front of different civic organizations or the leadership group, is to share about how busy the hospital is. I think it's important for the community to know. I talked about services a while ago, and just some stats for the listeners. We'll see 20 to 21,000 ER patients every year in our ER. I mentioned how many babies we're going to be delivering this year. 750, potentially close to that is what we're on pace to do. We'll do 2,100 surgeries a year in that hospital. We'll do 55,000 radiology procedures in that hospital. We'll discharge 2,200 people out of the inpatient unit, CCU, medical surgical unit area. We'll do thousands of lab tests. We'll produce over 150,000 meals in that building every year. So one thing to note about that is we can't continue to do the things that we do and advance the healthcare services in this community if people don't choose to come to Baptist when they need healthcare or choose a local provider. Choosing your local hospital is important. And it's just like, choosing to use your dollars downtown Union City or buying gas locally or, just the things that you do locally from a business perspective, it's just as important to utilize healthcare services here locally too, to keep healthcare services available for the community.
And your profession and service never stops.
24/7, 365, we're open. Every single day. We have to worry about things like inclement weather. We can't quit doing healthcare because of some ice on the road. Right. We're always open and available. So,
let me ask you this: what is one of the biggest issues in the health industry today?
Yeah, we talked a little bit about this before we got on the air. Is about the opportunities or people choosing to work in healthcare. Staffing is always a challenge in healthcare organizations. The cost of care keeps going up, and it costs a lot of money to add equipment and technology into a hospital. And I'll give you an example of some of those. We spent $150,000 on a new ultrasound machine this year. We're going to be spending, close to $200,000 on new anesthesia machines this year. We're spending $250,000 on retrofitting an elevator currently right now. It costs a lot of money to keep up an older building and to keep up with technology advancements, and so those are some of the challenges here locally in smaller communities. Recruitment's a challenge. Recruiting physicians to come to a market the size of ours. So we do focus on people like Dr. Davis, that's a Union City native, and trying to bring people like that back home because
Dr. Jernigan,
Dr. Clendon, and Dr. Hales from Halls, Tennessee, right. Dr. Dozier's from New Bern, Trimble area, Dr. Parker, he's from that area.
But they come back and make you great employees, don't they?
They do, yeah, and it's a calling for a lot of them too, to come back to their community to serve the healthcare needs of their community, and even not only the MDs but also our nurses and respiratory therapists and physical therapists and all of those that make up the fabric of what we do every day. So.
Yeah. People may not be aware just how many local people are working at the hospital.
There's a lot. There's a lot.
Yeah. Well, we are just about to run out of time for today's program. Again, we've been speaking with Mr. Skipper Bondurant, the administrator and CEO of Baptist Memorial Hospital, Union City, and we always like to give our guests the last word and give it to you, Skipper.
Just we're grateful to be here in this community. We're glad that we've been here since the early 80s as Baptist Memorial Healthcare Corporation, and of course, it was a county-ran hospital, from 1950 to the early 80s, and we're just blessed to be part of Union City and serving the healthcare needs of Obion County and the surrounding counties that seek care here. So, thank you for having me on.
Absolutely, and how fortunate Union City and this area is that Baptist Memorial Union City is here.
We're grateful to be here.
And that concludes this week's 30 Minutes program. We hope you enjoyed today's show. And, of course, we invite you to tune in again next week at this same time as we bring you topics and information of importance to our community. From all of us here at Thunderbolt Broadcasting, until we meet again next week, I'm Charles Choate.
You've been listening to 30 Minutes, a community affairs program on Thunderbolt Radio. You can listen to this broadcast and others anytime by visiting thunderboltradio.com and following the Thunderbolt Radio and Digital YouTube page. Thanks for listening.